If you're a parent of a young infant, chances are you've heard the word bronchiolitis, and it was probably spoken with a little bit of concern, especially during the winter. There's a good reason for that. It's one of the most common reasons tiny babies have to go to the hospital. So let's break down exactly what it is and what you really need to know. To really get why this is such a big deal, we can start with just one single powerful number. About 1 in every 3 babies will get bronchiolitis sometime in their first year. I mean, think about that. That huge number makes it the single most common serious respiratory infection for infants. And that's exactly why being in the know is so important. So, to make sure we get the full picture, we're going to walk through this step by step. First up, what even is bronchiolitis? Then we'll look at what causes it, learn the key symptoms to watch for, understand how doctors manage it, and finally, we'll talk about recovery and prevention. All right, let's start with the basics. At its very core, bronchiolitis is an infection of the bronchioles. Those are the teeniest, tiniest little airways way down in the lungs. And it's an illness that pretty much exclusively goes after the very young. And when I say very young, I really mean it. A full 90% of all cases happen in babies between 1 and 9 months old. It's a leading reason for hospital stays for this age group, making up to 3% of all infant hospitalizations during those winter months. Okay, so now that we know what it is, a couple of questions pop up right away. What's causing this? And are some babies more at risk than others? Well, while bronchiolitis is the name of the illness, there's really one main villain. Get this, a massive 80% of all cases are caused by one single virus, respiratory syncytial virus, or as pretty much everyone calls it, RSV. That other 20% is made up of a few other common bugs, the usual suspects. But here's something really important to note. It's actually possible for a baby to get infected with more than one virus at the same time. And unfortunately, those co-infections can sometimes lead to a much rougher, more severe case. Now, while any baby can get sick, some little ones are at a much higher risk for a really serious illness. We're talking about premature infants, especially those with a chronic lung condition called BPD. Also on that list are babies born with heart disease or those who have cystic fibrosis. Their little systems are just that much more vulnerable. And this brings us to probably the most critical part of this whole explainer for any parent or caregiver. How do you recognize it? What are the signs? How does this whole thing actually play out? Typically, the illness follows a pretty predictable script. It almost always starts out looking just like a regular old cold. Running nose, a bit of congestion, but then it starts to change into this very distinct, dry, wheezy kind of cough. And then the real signature symptom of bronchiolitis shows up. They start having trouble breathing, which of course leads to trouble feeding, because it's really hard for a baby to eat and breathe at the same time when they're struggling. Now, if you're watching a baby who's having a hard time breathing, you might hear a doctor use the word recession. All that means is that you can see the skin around their ribs pulling in and out with every breath. It's a really clear visual sign that the baby is working way harder than they should be just to get air. So let's just put that all together. The early signs, they look a lot like a cold, maybe some trouble with their bottle. But what you have to be on high alert for are the serious signs that mean you need to get help right away. That means any pauses in their breathing, any bluish color on their skin or lips, or if your baby is just super tired and lethargic, or the opposite, really irritable. Okay, so what happens if a baby is diagnosed with bronchiolitis? This is where it's so important to have the right expectations, because the entire game plan is about supporting the body, not curing the virus. It's the first thing every parent wants to know, right? What's the medicine? How do we fix this? What's the cure? And this is the tough part. The straight-up answer is there isn't one. Because it's a virus, there's no magic pill or antibiotic that can just knock it out. The entire focus of medical care is to be a support system to help the baby's body while their own amazing immune system does the heavy lifting of fighting off the virus. So a huge piece of the puzzle is knowing what doesn't work. Antibiotics? They're for bacteria, not viruses, so they're no help here. And a lot of research has shown that other common breathing treatments like steroids or asthma inhalers, or even those mist therapies, they just don't help with bronchiolitis. So if all that stuff doesn't work, what does? Well, it all comes down to support. Number one, making sure the baby stays hydrated. Sometimes that means a little feeding tube or an IV if they just can't drink enough. Number two, giving them oxygen if their levels get too low.
And in the really severe cases, using machines like a CPAP to help take the work out of breathing for them. Okay, let's turn the page to the final chapter here. What does recovery look like? And is there anything we can do to prevent this in the first place?
So here's a pretty realistic timeline. The acute phase, the really tough part of the illness, usually gets better within about 2 weeks. But, and this is super common, up to half of the babies might have a cough or wheeze that kind of lingers for a few months after. And then, in very, very rare situations, a really severe case can cause some permanent airway damage.
Now, for those most vulnerable infants we talked about earlier, the preemies, the ones with heart or lung issues, there actually is a preventative option. It's a medication called palivizumab. It's a monoclonal antibody that can be given as a shot every month during the winter to help cut down the risk of a severe RSV infection and a hospital stay. But let's end this on the most important and honestly the most reassuring takeaway. Even though it could be a really scary thing to go through as a parent, the vast, vast majority of babies get through the worst of it in a couple of weeks and make a full recovery. And that kind of leaves us with a big, hopeful question for the future. We know that the main enemy here is RSV. It's causing 4 out of 5 of these cases. So as vaccine technology keeps getting better and better, you just have to wonder, could a really effective RSV vaccine one day make these stressful winter hospital trips a thing of the past?